Good morning to Dr. FARIESYA and my fellow classmates. Today, me and my group will present about our research on dental implant failure. This is our team and I'm a group leader. My name is CHONG JI HUI with my matric number 221151488. This is the agenda for our presentations, and basically our research are about the factor that cause the dental implant failure, the biomaterial that address to this issue, and the biological evaluation test before conducting the implantations based on the ISO 10993 Part 1. We also provide a proposal for the new dental implant. Let's start our discussions with JEEVITA.
Hello, my name is JEEVITA SELVAKUMARAN and my matrix ID is 22115149. So now, I'm going to explain about the factors which contributes to dental implant failure. So there are two types of dental implant failure, which is internal and also external. So first, for internal, the factor will be patient factor. First is systemic condition, which conditions such as diabetes, osteoporosis, and also autoimmune illness. Second is oral health, which the pre-existing periodontal disease and inadequate oral hygiene. And also the third will be lifestyle habit, such as smoking, bruxism, and also excessive alcohol consumption. And the second factor in internal is biological responses. First will be peri-implantitis, an inflammatory disorder that affects both the soft and hard tissues around dental implants. And the second will be infections, like bacterial infection can disturb the healing process and result in implant failure. So now, under external, there are two factors. One of the factor is operational related. For example, surgical technique, like incorrect implant placement harm to nearby anatomical structures and other trauma-causing conditions. Next example will be septic condition and appropriate implant materials. So maintaining sterile conditions and choosing the appropriate implant materials and sizes are critical. Next factor for external will be mechanical factors, like implant design. So poor design may result in stress concentration and mechanical failure. And the second factor is prosthetic complications. Loose abutment, screw loosening, and prosthetic tooth fractures can all endanger the implant stability. That's all from me for now. Thank you.
Assalamualaikum. My name is NURIN ELLYSA binti NORSHARIL. Okay, for the question 2, it asks to describe at least 3 biomaterial approaches. Firstly is surface coating, which is titanium surface treatment. For example, is titanium dioxide. Anodization and sandblasting are techniques used to make the surface of titanium implants roughter, which help to improve the connection between the bone implant by creating an interlock. Other than that is biomimetic coating. For example, is hydroapatite. It is utilizing protein and peptide coating such as bone protein that stimulate bone growth that greatly improve and bonding of the implant to the bone tissue. Secondly is antimicrobial coating. Silver nanoparticle added to the surface release silver ion with properties that work against a wide range of bacteria. This feature aids in averting build-up and lowering the chance of peri-implantitis. Other than that is antimicrobial peptide coating are proteins that have the ability to kill the bacteria via the membrane destruction. Application of antimicrobial peptide to implant the surface can also help to establish a strong and efficient antimicrobial covering. Lastly is biocompatible alloy. For example, is the titanium aluminium vanadium alloy is the most used in titanium alloy in making dental implant since it is compatible and corrosive resistant. Such an alloy demonstrates high strength and acceptable level of porosity that make it suitable material for it in use in the dental application. Other than that is zirconia. It is a high-performance polymer known for its excellent mechanical properties and capability. Zirconia nanoparticle enhance its mechanical strength and were resistant, making it suitable for dental implant. That's all from me. Thank you.
I am FARIESYA binti ROSLAN. In medical device categorization, dental implant is under category tissue or bone implant devices. For nature of body contact, the dental implant would fall under the implant medical devices category as it directly contact body tissue for an extended duration during its intended use. For the contact duration, dental implant would be categorized under the long-term contact category as it remains in contact with body tissue for an extended period. The compatibility of biomaterial used in medical implants, especially dental implants, holds significant importance in ensuring their durability and safety over time. Next, for biological evaluation tests. First, genotoxicity refers to the ability of a substance to cause damage to DNA, which can lead to mutation, chromosomal abnormalities, or cancer. Second, sensitization testing is a biological evaluation test for medical devices aiming to assess the potential of a device or its component to induce allergic reaction in patient. Third, irritation testing involves applying the device directly onto the skin or mucosal membranes of suitable test subjects such as animal or human volunteer. The skin is then observed for signs of irritation such as redness, swelling, or inflammation over a specified period. Fourth, cytotoxicity. Testing is a biological evolution process for medical devices focusing on assessing the potential toxicity of a device or its extract to living cell. This test evaluates the effect of the device on cell viability and function, providing crucial insight into its safety and compatibility with biological tissue. Fifth, systemic toxicity. Testing is a biological evolution process for medical device focusing on assessing the potential adverse effect of a device or its component on an entire organism rather than just on specific tissue or cell. Lastly, implantation testing is a biological evolution process for medical devices, specifically assessing the body response to the implantation of the device into living tissue. This test provides valuable insight into the device biocompatibility, potential for tissue integration, or complication following implantation.
I'm Bekhayan and my number is 2211511479, and I'm going to present about the design of dental implant of our team. So let's start with the main components. So we have the crown, the fissure, the abutment, and also the screw. So the crown serves as the visible and functional part of dental implant, while the fissure serves as the artificial tooth roof and provide a stable foundation for the crown. So the abutment will connect the crown and fissure together, and lastly the screw is to ensure the stability and retention of the crown by firmly attaching the abutment to the implant body. So the fissure can also call as the implant body. Next is the material consideration. So we have 5 generations here. Let's start with the first generation, which is titanium alloy, and we have zirconia from second generation, hydroxide apatite coated titanium from third generation, nano hydroxide apatite from fourth generation, and also shape memory alloys from fifth generation. So next is the design consideration. So we have 3 properties here: chemical properties, morphological properties, and also the mechanical properties. So moving on to the chemical properties. So biocompatibility is to ensure the material is non-toxic and do not cause adverse reaction. So the corrosion resistance is to resist the degradation when adhered to oral fluids. The bioinerness is to minimize the interaction with biological systems and to prevent the rejection. Morphological properties. So a rough surface is to enhance the bone cell adhesion, the porosity for optimal blood vessel and bone cell infiltration, and also the moderate roughness for effective bone formation. So lastly is the mechanical properties. We have strength to provide a adequate strength to withstand the chewing force. So we have same bones elastic modulus to prevent the stress yielding, and lastly is the toughness and fatigue resistance is to resist the crack propagation and withstand the cycle loading. So I think that's all for me. Thank you.